What makes someone completely change the face the world once knew? Is it beauty or the search for happiness? We uncover the most extreme cosmetic transformations from real-life dolls to painful regrets, revealing the true cost of perfection. Which transformation shocked you the most? Comment below and don't forget to like, share, and subscribe. Jessica Alves, the real-life Barbie doll. Jessica Alves stands as one of the most discussed and unsettling figures in the modern conversation about cosmetic surgery. Once widely known as the human Ken doll, she later transitioned and publicly embraced her identity as Jessica, a woman many media outlets labeled the real-life Barbie. Her story is not simply about transformation, but about an unrelenting pursuit of physical perfection that gradually took control of her life. Over the course of more than a decade, Jessica underwent well over 100 cosmetic procedures. The list is staggering: repeated rhinoplasties, jaw reconstruction, cheek and chin implants, lip augmentations, body contouring, and countless corrective surgeries. Little of her original appearance remains. Each procedure promised refinement, yet seemed to demand another, and then another. In the early years, public reaction was mixed, but often sympathetic. Many believed she was bravely expressing herself, choosing happiness on her own terms. But as the surgeries multiplied and complications mounted, admiration slowly gave way to concern. Friends, doctors, and viewers alike began to question whether this was still self-expression or something closer to dependency. Her appearance changed so dramatically that she became difficult to recognize, sometimes described as less human and more artificial, even unsettling. Yet the most troubling aspect of Jessica's journey is not the transformation of her face, but what appears behind it. Despite global attention, media fame, and endless surgical intervention, there is little visible peace or fulfillment. Jessica Alves's story serves as a sobering reminder. Cosmetic surgery can alter the body, but it cannot heal emotional wounds. And when the search for perfection replaces self-acceptance, the cost may be far greater than anyone expects. Justin Jedlicka, the real-life Ken doll. Justin Jedlicka is widely known as the world's most famous real-life Ken doll, a title that has brought him both fascination and controversy. Over the years, Justin has openly documented an extraordinary journey of self-transformation, undergoing hundreds of cosmetic procedures in pursuit of what he considers the ideal human form. His body, reshaped through implants, surgical enhancements, and repeated refinements, has become a deliberate work in progress rather than a finished result. Unlike many who seek surgery to correct perceived flaws, Justin approaches cosmetic modification as an art form. To him, beauty is not about fitting into society's expectations, it is about control, design, and self-authorship. His arms, chest, calves, and facial features have all been sculpted to reflect a vision he alone defines. In his own words, the human body is simply another medium no different from marble or clay. Yet this radical approach has raised serious questions. Critics argue that such extreme alteration risks crossing the line between self-expression and self-destruction. In a culture already burdened by unrealistic beauty ideals, some worry that Justin's example reinforces the idea that the natural body is never enough. Supporters see something different. They view Justin as unapologetically honest, a man exercising personal freedom without shame or secrecy. He speaks openly about his motivations, revealing the psychological depth behind his choices rather than hiding behind spectacle. Whether admired or criticized, Justin Jedlicka undeniably forces us to confront uncomfortable questions about identity, autonomy, and the human desire for perfection. His story is not merely about surgery, it is about how far one is willing to go to become exactly who they believe they are. Martina Big, the controversial transformation. Martina Big is widely regarded as one of the most divisive figures in the world of extreme body modification. Born in Germany, she initially lived a relatively conventional life, working as a flight attendant before turning to modeling. In an industry driven by visibility and shock value, Martina began altering her appearance dramatically, starting with extensive breast augmentation. Using custom saline implants, she expanded her size to over 32T, placing her among the most surgically enhanced women in Europe. Yet physical exaggeration was only the beginning. In 2017, Martina drew international attention when she began injecting melanotan, a synthetic substance known to darken skin pigmentation. Over time, her skin tone became significantly darker, and Martina publicly declared that she was transitioning into a black woman. She claimed that doctors observed changes in her facial features and expressed plans for future surgeries to reshape her nose and lips to align with what she described as African characteristics. These claims triggered widespread outrage. Critics accused Martina of reducing racial identity to cosmetic appearance, arguing that black identity is rooted in shared history, culture, and lived experience, not something that can be acquired through injections or surgery. Many saw her statements as deeply offensive, framing them as cultural appropriation rather than self-expression. Martina, however, rejected these criticisms. She insisted her transformation was authentic, citing visits to Kenya, participation in a tribal blessing ceremony, and legal changes to personal documents as validation of her identity. She further fueled controversy by suggesting that her physical changes might be genetic, even expressing hope that future children with her husband would be born with darker skin. For many observers, Martina Big's story represents a troubling boundary where personal freedom collides with social responsibility, and where the desire for transformation raises profound ethical and cultural questions that surgery alone cannot answer. Carol Bryan never imagined that a routine cosmetic treatment could permanently alter her life. In 2009, she was a confident, outgoing woman who simply wanted a modest facial enhancement. Like countless others, Carol trusted that a filler injection would refresh her appearance. Instead, it set off a medical catastrophe that would leave her disfigured and blind in one eye. Shortly after the procedure, Carol's face began to swell abnormally. What was expected to be a minor reaction quickly escalated into severe facial distortion. The filler, later believed to include permanent silicone or non-approved substances, migrated and hardened within her tissue. As pressure increased, it caused irreversible damage to her optic nerve, ultimately robbing her of vision in one eye. The physical consequences were devastating, but the emotional toll was even greater. Carol no longer recognized the woman in the mirror. Ashamed and traumatized, she withdrew from public life, avoiding social contact and even isolating herself from close family members. For years, she lived in silence, convinced that nothing could undo the damage. Her turning point came through her daughter, who refused to give up hope. After an exhaustive search, she found help at UCLA, where surgeons, Dr. Reza Jarahi and Dr. J. Brian Boyd, agreed to take on Carol's extraordinarily complex case. Over multiple operations, including an intense 16-hour reconstructive surgery using tissue from her back, they worked to restore both function and dignity. Today, Carol Bryan is more than a patient who survived tragedy. She is a vocal advocate for patient safety, traveling across the country to share her story. Her warning is simple but urgent: cosmetic procedures are medical procedures, not beauty treatments, and the risks are real. Raji Nareen Singh, a cautionary story of trust and survival. Raji Nareen Singh is a transgender actress, author, and activist whose life story reflects both extraordinary courage and profound tragedy. After years of internal struggle, Raji made the difficult decision to live openly as her true self. Like many transgender women, she hoped that facial feminization procedures would help her feel more at ease in her own skin. But the high cost of legitimate medical care placed those dreams painfully out of reach. In search of an affordable alternative, Raji turned to O'Neill Ron Morris, a woman operating illegally and posing as a medical professional within vulnerable communities. Known as the Duchess, Morris was not licensed and did not use approved medical fillers. Instead, she injected a dangerous mixture of industrial substances, including cement, mineral oil, and other non-medical materials. Trusting what she believed was a professional, Raji underwent the procedure unaware of the devastating consequences to come. Soon afterward, her face swelled severely and became disfigured. The pain was intense, but the emotional damage was equally crushing. Ashamed and fearful, Raji attempted to hide behind wigs and heavy makeup, withdrawing from public life as her confidence eroded. Eventually, Raji found the strength to speak out. She appeared on the television program Botched, where qualified surgeons were able to reduce some of the damage, though full restoration was impossible. More importantly, the experience helped Raji reclaim her voice. Today, Raji Nareen Singh uses her story to educate and protect others. She advocates for safe, licensed medical care and greater respect for transgender patients, reminding the public that desperation when met with exploitation can have lifelong consequences. Sahar Tabar. The Angelina Jolie obsession. Sahar Tabar, a young woman from Iran, rose to international attention through a series of startling images that spread rapidly across social media. Her look, often described as an extreme imitation of actress Angelina Jolie, sparked shock, ridicule, and widespread misunderstanding. With sunken cheeks, exaggerated lips, and an unnaturally sharp nose, Sahar's appearance quickly became viral, earning headlines that framed her as a tragic example of cosmetic obsession. In reality, Sahar's transformation was far more complex than many reports suggested. While she did acknowledge undergoing limited cosmetic procedures, much of her appearance was the result of heavy makeup, prosthetics, lighting tricks, and digital filters. The illusion was deliberate, crafted for online attention rather than real-life resemblance. Still, the reaction was intense. Some mocked her relentlessly, while others expressed concern, especially given her young age. She was barely in her early 20s at the height of her notoriety. Behind the spectacle lay deeper issues. Sahar's online persona appeared to reflect insecurity, isolation, and a powerful desire for recognition in an increasingly unforgiving digital culture. What may have begun as creative expression soon became a source of overwhelming scrutiny and judgment. In 2019, Sahar was arrested by Iranian authorities not for cosmetic surgery, but for charges related to blasphemy and promoting immorality through social media offenses tied to Iran's strict cultural and religious laws. Her sentencing sparked international criticism, and after spending time in prison, she was later released following broader legal reforms and public pressure. Sahar Tabar's story is ultimately less about beauty and more about the dangers of internet fame. It serves as a cautionary tale about identity, mental health, and how online validation can distort reality, sometimes with lasting consequences. Pixie Fox, the real-life cartoon character. Pixie Fox is a figure who seems to blur the line between fantasy and reality. Inspired by animated heroines and comic book imagery, she set out to transform herself into what she describes as a living cartoon character. For Pixie, conventional beauty was never the goal. Instead, she pursued an exaggerated, stylized look drawn directly from the world of animation. Over the years, Pixie underwent numerous cosmetic procedures to achieve her vision. These included lip enhancements, multiple facial surgeries, breast augmentations, and dramatic waist reduction. She famously claimed to have had 6 ribs removed to create an extremely narrow waist, an assertion that fueled both fascination and skepticism. Whether literal or symbolic, the result was undeniable, a silhouette that looked almost impossible by natural standards. Pixie also experimented with altering the appearance of her eyes using cosmetic techniques and accessories to create a wide-eyed, doll-like effect. Combined with heavy makeup and carefully curated styling, her overall appearance became strikingly cartoonish, surreal, polished, and deeply unconventional. To many observers, the transformation is both impressive and unsettling. Seeing animated proportions on a real human body challenges deeply ingrained ideas of realism and anatomy. But for Pixie, the reaction of others has never been the point. She has consistently stated that her appearance is a personal artistic expression, not a plea for approval. Maintaining such an extreme look requires constant effort, discipline, and physical endurance. Yet Pixie presents herself with confidence and calm certainty. Her story invites a larger question: where does personal freedom end and social discomfort begin? Whether viewed as bizarre or fascinating, Pixie Fox forces us to reconsider how identity, fantasy, and self-image intersect in the modern age. Thank you for taking the time to watch this video. If you enjoyed the content, don't forget to press like, share the video, and subscribe to the channel so you won't miss the next exciting stories. Your support is our motivation to keep bringing you even more great content. See you in the next video.